Good afternoon, everybody. Thank you for being here. Today from the Department of Health, I have Dr. Guidry, who will be available to answer specific questions later, but also have Dr. Ghali from the LSU Health Shreveport, who's going to deliver some remarks in just a few minutes. So today we are reporting 1,769 new cases on a little more than 22,000 tests. That brings our total cases to 114,000. There are a couple of positive points in today's numbers. There was a drop in hospitalizations and a decrease in the number of patients on ventilators. And that's obviously a good thing. Of course, we really need to see this continue over a number of days before we can say that it's a trend and then it's real, as opposed to something that's going to be very temporary. Anywhere we can find good news, we'll certainly take it, though. Unfortunately, we lost another 42 Louisianans, and that's what we're reporting over this 24 hours. We've now had 3,811 people die from COVID-19 in Louisiana. Each one of them and their families are certainly in need of our prayers, and I would ask my fellow Louisianans to lift them up in prayer. Yesterday was quite a gut punch. We had our largest number of deaths that we reported in a 24-hour period in about 2.5 months, with 69 individuals who had died. We know that deaths are a lagging indicator of what's going on, because the first thing you're going to see is people contracting the illness, then they're going to go into the hospital and so forth. And the deaths are a lagging indicator. And so, we hope that we're seeing the beginnings of a trend toward a plateau in cases, although it's at a very high level of cases, and that concerns us. But it appears over the last several days that they're not getting, not growing, but it could be some time before this shows up in substantially fewer deaths. And that's the bad news there. But I can tell you that we do have a couple of regions in the state, principally in the Monroe area and in the Alexandria area, where you have increasing hospitalizations. And when I talked about decreasing hospitalizations, that is statewide and in the rest of the regions. The most important thing to know is the situation remains very, very serious. There's more COVID-19 in Louisiana and in every community across Louisiana than at any point up to now. Earlier today, I was able to do a deep dive on the data with LDH. I will share a few things with you. In general, in every region of the state, our present positivity is over 10%. That concerns us tremendously. And when we look at the dates that the tests were actually done, that's how we determine our positivity rate. As of July 24th, the positivity rate for the state was 14.34. And as you all know, the standard is you really want that below 10%. And in addition to being below 10%, you don't want it increasing. Because anytime the positivity rate is increasing, then you know there's more community spread than you would like. In every region of the state, the R0, or the rate of transmission, is above 1. That too is very concerning, because anytime the transmission rate is above 1, that means that for every person who's infected, more than one additional person will be infected. And so you're not at a rate where that's dissipating, but continuing to grow, and that's a problem. And so just like the positivity rate, we need to get our rate of transmission down. We approximate that there are about 38,000 known active COVID-19 cases in Louisiana right now. And by a known case, we mean one that derives from a positive result on the test. That does not count the 25 to 40% of people with COVID who are going to be asymptomatic, because we know that very few of those individuals actually get tested and get that result. But nevertheless, they are infected. They're infectious. They're shedding virus, and they can spread it. And that's really what makes this particular pandemic so hard to try to manage. And yes, we remain on the top of the list of states with the most cases per capita. We are above Arizona, above New York, above New Jersey, Florida, all these other states. So at this time, I thought you would benefit, and we've done this several times over the last few weeks, is to bring in healthcare professionals from different parts of the state who can share what their observations are. And today we asked Dr. Ghali to come down from Shreveport, so I'm going to ask him to come up and share some observations with you all. If you've got questions for Dr. Ghali, I would ask you to ask those of him while he's at the podium, and when he concludes, I'll come back up and finish my remarks, and then we'll take your questions.
Thank you, Governor. It's my honor to be here and to represent the Louisiana State University Health Science Center in Shreveport. As the Governor said, I'm the Chancellor of the LSU Health Science Center in Shreveport, Louisiana. And as you know, we have our major teaching hospitals in conjunction with the Ochsner LSU Health System in North Louisiana. 3 hospitals, 1 in Monroe, and 2 in Shreveport. And what we have seen over the past several months is really the following. We have not had quite the number of cases in the north as they've had in other parts of our great state, but we are seeing a rise. If you look at the last 30 days or so, it is a fairly steep rise that we've been seeing. As the Governor mentioned, the last 2 or 3 days, we've seen a bit of a plateau, but again, we have insufficient data. It's not enough time for us to really determine, are we on a downslope? We hope that we are at least on a plateau or on a downslope. You hear a lot about surge capacity, and it's really an interesting term. I remember getting a call from the Governor several months ago saying, you know, golly, we need to improve our potential surge capacity in North Louisiana. And it was a very important move on the part of the Governor, and I mean that. What do I mean by that? When we started out, we had 50 ICU beds, and we were able to expand through various modalities from 50 to 150 ICU beds. So if you look at the data from the Department of Health, Region 7, which is the Caddo region, Caddo, Bossier, and the surrounding parishes, interestingly, we have the highest or the greatest number of available ICU beds currently. Doesn't mean that we don't have COVID patients, because we certainly do have COVID patients. As a matter of fact, we are nearly as high today as we were back on the, I want to say, 8th of April, where we had the highest number of COVID patients at about 70 patients at that time, of which 20 were on the ventilator. We don't have quite that many, but we're very, very close to that as we speak today. The ability to increase our surge capacity has allowed us to have a little bit of a buffer in the North Louisiana area, and that's really very, very, very important from an ICU bed standpoint. Also, we were able to create a couple of labs to do special testing. In addition to the lab that we have at the Health Science Center, the EVT lab, what we call the Emerging Viral Threat Lab, that lab has a capacity, as we sit here today, to do over 1,000 tests a day. With some of the next-gen sequencer that we're procuring with the help of the Department of Health, we're going to be able to double and likely triple that amount over the next 10 to 14 days. In addition to that, we have a lab in our hospital at the OLHS, which is doing quite a bit of testing, mainly in-hospital testing. The EVT lab has been doing mainly testing in the nursing homes and some community testing. What's important about that? We believe we've contained the nursing homes. That was a real charge of the Department of Health. Hey guys, we need to contain the nursing homes because this is where the most vulnerable population is. So we've contained the nursing homes to the point where the positivity rate is between 3 and 5%. What we've not been good at containing is the community spread of this disease, as the governor has mentioned on multiple occasions. The positivity rate is somewhere between 12 and 15% is what we're seeing in our community testing. That's unacceptable. And in my mind, that's related to too many people gathering, crowds being too large, people not abiding completely with the governor's orders, and not wanting to wear a mask. It's ridiculous to say that one should not wear a mask. As a surgeon, I've wore a mask for over 30 years to protect not just myself, but primarily to protect other people, to protect the patient. So I would encourage you guys to do that. I would encourage you to support the governor and his efforts in that regard. Last thing I want to mention is convalescent plasma. Our health science center and our hospital were the first place in Louisiana to administer convalescent plasma to a critically ill COVID-19 patient. We've now administered over 25 patients with convalescent plasma since we started that program. We were the third program in the United States to do that, and it's helping. So I encourage those of you that have recovered from COVID-19 that are healthy and recovered to please consider donating your plasma to this cause. And it's a very, very worthy cause. And with that, Governor, I want to thank you for allowing me to make these comments, and I'm available anytime y'all want questions. Hopefully I can answer them.
Can you talk about whether, to what extent hospitals have gotten better at treating hospitalized patients and the impact that may have on the death rate? We've obviously seen the death rate start to spike. Do we expect to see the death rate spike to a smaller degree than maybe the spike in deaths we saw in April?
Right. So the question is related to any advances in health care at the hospital level that we've seen that may be contributing to a lower death rate compared to, say, 3 months ago. And you're absolutely right. People want to say, well, the death rate is coming down. Again, it does lag, as the governor is saying. What we're seeing is a couple of different things. One, I do believe that the older populations, the more senior populations in our state are the ones that are listening the most about the mask. The younger populations are not. So what we're seeing is an increased number of the younger populations. The 29 and under group, if you look at the data from the Department of Health, which I have no reason to disagree with because we're seeing that same thing, that's the group that's becoming most affected right now with COVID-19. And obviously, because they have the less number of comorbidities, they've got the best opportunity to potentially recover and to be less of a chance of needing to be hospitalized. So that's one big reason. The other big reason that we may be seeing a lower death rate and in some instances a lower hospitalization rate comparatively, we don't want it to go up, and it's been going up, but comparatively, is that we have improved, the critical care doctors have improved their modalities of treating these patients. Certainly, I believe remdesivir is helping proning the patient. The inhaled nitric oxide that we've talked about before and that has been published and discussed in the media. Early use of steroids, and trying to not get the patient on mechanical ventilation if at all possible. So those factors, I think, are leading to a potential lower death rate. But again, as the governor's mentioned, every death is really unacceptable. It is unacceptable. Yes, sir.
Talk to me about convalescent plasma treatment. You said it's helping, but how is it helping with the sorts of
right? So So basically, this blood is donated by someone that's recovered from COVID-19. There's a process through LifeShare or any of the available blood banks around the state to then siphon the plasma portion off of the blood, the so-called clear portion. Blood, when you look at it, it's all red, but if you centrifuge it and you get the clear portion, that's the plasma. That plasma is what contains the antibodies from that patient. And so those antibodies are then administered into a critically ill patient, and they then attack the virus. No, it leads to a treatment, and it doesn't lead to a permanent cure for that patient or permanent immunity, but it will help them fight that virus to get over what is going on during that critically ill period of time, which could be things like ARDS, adult respiratory distress syndrome. It could be other forms of multi-system organ failure or the cytokine storm that you hear about. These are all things that convalescent plasma may help with. So I encourage everyone around the state to donate plasma. Yes, sir.
You mentioned that you added a lot of physical capacity, adding beds and ICU beds in particular. In other parts of the state, we've seen issues not necessarily around beds, but staffing.
Yeah, that's a great question. Great question. And the question is related to we increased the number of beds, but in certain parts of the state, we're also seeing issues with staffing. And that's correct. We need nurses. There's a huge nursing shortage to start out with. Many of the nurses, to sort of mitigate that nursing shortage, we're talking pre-COVID, oftentimes we would bring agency nurses in from out of state to work. When the number of elective cases dropped back in April as the height of this pandemic was occurring, and we were trying to preserve our bed capacity and our ability to take care of these patients. Many of those agency nurses had to be temporarily laid off or furloughed for a while. Well, most of them are from out of state, so they're hard to bring back. So there are some staffing issues that we're having to deal with right now, and I think that is some of the reason why at the physician level, at the dentist level, at the nursing level, at the allied health level, the state has temporarily lessened some of the restrictions in bringing folks from out of state to get licensure here, and that's helping as well. So those are all critical things. Yes, sir.
They described it as being strained almost to the point of being overwhelmed. Is that dire in the Shreveport Health?
Say that again.
They described it as being strained to the point of almost being overwhelmed. Is staffing that much of an issue? Is that dire in your system?
I wouldn't say it's that dire, but I would say that we could use, right now, we could use another 100, 150 nurses easily. The problem is sort of double-edged. Part of it is the employment issue and everything else, but part of it is healthcare workers are the frontline workers, as the governor would say, right? And it's those individuals that are potentially becoming ill. So if I have a healthcare worker that gets ill and is febrile, I may have to put them in quarantine for 10 to 14 days. Well, if I put them in quarantine for 10 days, it's 10 days they can't work. And that really becomes a critical factor. So being on the front line is a huge risk factor, depending on the specialty of that individual. An anesthesiologist or oral surgeon, ENT doctor, those are all high risk because they're the ones that are working around the area of the nose, of the mouth, of the throat, where the virus tends to be shed. But again, the most critical factor is mask, hand washing. I'm very optimistic about a vaccine. I love to be optimistic about it, and I'm hoping that we have something before the end of the year with the help of the good Lord. But still, we wear a mask, and we stay socially distanced, and we wash our hands, and that's the way to go. Thank you, sir. Thank you, Governor.
Thank you, Dr. Golly. And to get back to your question, when we had our first surge in cases back in the March, April time period, there were exactly 0 approved therapeutic treatments. Today we have 3, and so that does make a difference. And whether it's the steroid, the dexamethasone, I think is the one, or whether it's remdesivir, or the convalescent plasma transfusion that was to a large degree pioneered in Shreveport. It's one of the reasons why it is an approved therapeutic treatment by the FDA is some of the early work that was done there. But those things have to be administered to that patient early on during the hospitalization and before the patient decompensates in order for it to really be effective, which means that bed has to be available when that patient needs it. And that's what we're trying to make sure that we can satisfy, is the demand on those beds, and keeping in mind that the non-COVID patient population across the state of Louisiana today is much higher than it was during the first surge as well, because you can only put off so long having individuals come to the hospital who need to be hospitalized and treated. And so all of those things are putting pressure on the staffing at our hospitals across the state of Louisiana, and not at the same level. And so while he can use 150 nurses in Shreveport, in Monroe, his needs aren't as acute as they are right now in Lake Charles and in Lafayette and here in Baton Rouge and in Alexandria. But obviously we want to make sure that we get on top of this before everybody's needs become more acute than they are at the moment. I did want to give an update on the Department of Corrections. It's in the midst of a mass testing program that it's going to be implementing at various prisons. In fact, they've been doing testing for a while. Today, the department will complete its mass testing at Allen Correctional Center, which includes the entire prison population of 800 inmates and all 152 staff. The testing's been ongoing. It's ramped up over the past several days. Specimens have been collected and tested by LDH and private labs, and some staff testing is performed by the employee's private physician as well. As of yesterday, at Allen, 182 inmates had tested positive, of which 147 were asymptomatic. This translates to 80% of those positives being asymptomatic individuals. That's still a problem because they have the disease. They are certainly contagious, but the good news for those particular inmates is that they are asymptomatic. The department is also currently in the process of mass testing assisted living dorms at the Louisiana State Penitentiary. To date, all testing at Angola, a total of 1,484 tests, have been completed prison-wide. Next week, DOC will begin mass testing of all inmates and staff at Rayburn Correctional Center in Washington Parish. And once completed, mass testing will begin at Raymond Laborde Correctional Center up in Avoyelles Parish. Previously, the Department of Corrections mass tested both state-run women's prisons and testing all staff and inmates at LCIW Hunt in April and everyone at LCIW Jetson in May. So we were asked a little bit about that the other day. Today, it was reported to me that we have one inmate who is in hospital. That inmate is not in an ICU bed or on a ventilator. And so obviously, we hope that those numbers don't get worse there, and they're working extremely hard to make sure that that happens. Also wanted to give an update on the Department of Children and Family Services and SNAP benefits. We anticipate seeing a surge in SNAP applications now that the pandemic unemployment benefits are going to run out on the 31st, at least until such time as Congress renews them at some level. And so we think we're going to see more individuals applying. The USDA has issued a number of waivers that will be important to clients as they continue to navigate this crisis. First, emergency SNAP benefits have been approved. So in August, SNAP recipients will again receive the maximum benefit for their household size. Those not currently at the maximum benefit will receive a separate supplemental benefit to bring them to the maximum. This is the 6th straight month that SNAP recipients have received emergency allotments. The first 5 months of the supplements have meant an additional $211 million, $211 million in federal SNAP benefits for Louisiana residents, all of which has gone to support Louisiana businesses as well. Second, SNAP certifications for August have been extended until February 2021, and initial interviews for new SNAP applicants have been waived during the month of August. This allows DCFS to focus on SNAP applications and have more workers available to handle applications, reducing wait time for those applications to be processed. And third, the federal rule that limited able-bodied adults without dependents, sometimes they're referred to as ABODs, to only 3 months of SNAP benefits unless they met federal work requirements, was also suspended through August the 31st or until new standards come into effect. And for more information about SNAP, including step-by-step instructions for applying for these benefits, please visit dcfs.la.gov/getsnap, dcfs.la.gov/getsnap, or you can text GetSNAP, that's GetSNAP with no spaces, to 898-211, 898-211. We do have some good news to report today in the education arena. Yesterday we learned that Louisiana was one of 11 states awarded grant funding by the U.S. Department of Education. That's going to better allow us to serve students during the COVID-19 pandemic. Specifically, Louisiana was awarded $17 million of the Rethink K-12 Education Model Grant, which is going to provide over 75,000 Louisiana students access to micro grants for remote learning resources, including at least 12,000 who will receive devices or hotspots through this program. And I want to thank Department of Education Secretary Betsy DeVos for selecting Louisiana to receive these valuable resources and the call that she made to me yesterday morning with that announcement. On another positive note, it does not currently appear that Tropical Storm Isaias will impact the Gulf of Mexico, and that's certainly good news for Louisiana. That said, we remain in hurricane season, and typically, at least over the last number of years, the August-September timeframe have been that part of hurricane season where we've seen the most storms. So I ask everyone to be alert, be aware, get a game plan, go to getagameplan.org if you haven't done so already. Finally, I want to remind people to respond to the census. If you haven't done that already, we've got a 57% self-response rate. Nationally, it's 63%, so we're lagging. And in fact, in terms of responses, we're 45th out of the 52 states and territories that are actually responding to the census. So we've got some work to do. It only takes a few minutes to fill it out, but it helps everyone in our communities across the state tremendously. And everyone should be counted, from babies to adults and everyone in between. So you can visit my2020census.gov. Our state will actually be the first in the nation to have its own Census Day on August the 26th as well. You all are probably aware that my latest proclamation will expire next Friday, and so we anticipate that I'll sign another one on Thursday of next week. And I will be meeting with LDH to get more information about the most current data on Monday of next week, and potentially Tuesday as well, to inform what it is that we're going to do at that time. I do think the people of Louisiana ought to not expect that we're going to be making major changes every 2 weeks. It seems like we've sort of settled in sort of where we are, and so I don't want people leaning forward thinking there's going to be some major change. That doesn't appear likely based on the current data. And sometimes people, I think, are even thinking that if the numbers improve a little bit, we're going to move away from the most recent mitigation measures like the mask mandate and so forth. I don't anticipate doing that. The mask mandate, that's just part of the new normal. I think Dr. Golly explained it extremely well. And I just think people need to be prepared to continue with that. And by the way, it remains a very small price to pay to protect the health of our neighbors, our loved ones, and for them in turn to protect your health as well. So at that, I'm going to take your questions. We do expect to be back with you twice next week on Tuesday and Thursday, 2:30 p.m. Should that change, we'll certainly let you know. But we anticipate being here Tuesday and Thursday of next week at 2:30 with press conferences. Yes, sir.
So to follow up on the testing at prisons, you mentioned that almost 1,500 tests have been completed at Angola. How many positives did that produce, and what was the time frame for that?
I don't have that information with me right now. We'll get it to you. I was actually briefed on it this morning, but it's part of a briefing that I get that's about 3 inches thick. I didn't bring it in here. But the question had to do with testing at Angola and how many were tested over what period of time and how many were positive.
You're doing all the prisons except for the women's prisons this time because you did those in May, right? Is that right?
We did complete mass testing at women's prisons first, and we're rotating through, and we're going to. It's not like we're going to test once and be done, but we're rotating through, and of course they have a lot of management that they're doing through isolation, reverse isolation. When someone comes in, they're quarantined for a 14-day period. Obviously, if they're symptomatic, they get quarantined, they get tested. The good news is right now the entire corrections population in the state of Louisiana, there's one individual who's in the hospital. I think the number of deaths total from the beginning among the inmate population is right around 16. I'll get that number to you shortly. And we're at 5, I think, correctional officers. So these are staff members of our facilities that have actually died from COVID. Yes, sir.
Dr. Ghali may have touched on this, but there's concern that right now the concern with the healthcare system is that doctors and nurses are also contracting COVID-19, and that is attributing to the staffing issues. Is that what we're seeing statewide?
Yes, to varying degrees, but statewide. Anytime you have community spread, when you have disease prevalence, the way we have right now with respect to the COVID-19 burden, and you have the rate of transmission being what it is, the positivity and so forth, that spreads through the community. And every day, the doctors and nurses and respiratory therapists and everybody else who works as a healthcare professional, they leave their community to go to the hospital. So this is a major limiting factor. It's something that I have heard personally from a number of medical directors of our hospitals across the state and CEOs of these hospitals. And in addition to the COVID patient count that has increased and the non-COVID patient count that has increased, this is impacting their ability to staff. And so obviously we look forward to those individuals recovering and coming back to work. But it's also very important that medical professionals, just like the rest of us, realize that you are safer at home than you are anywhere else, that they need to minimize their travel and the contacts that they make and make sure they wear their mask when they're outside their home and they keep physically distant, at least 6 feet from people not in their immediate household. And obviously, like everybody else, and probably even more so, stay home when they're sick and get tested. And so, our healthcare professionals have done a tremendous job, but they get sick like the rest of us. And so that is part of what's taking toll on the ability of our hospitals to staff the beds right now. Sam?
Early on in phase 1 and phase 2, there was a specific set of guidelines from the White House we looked at, and it was whether we meet these 14-day trends.
Yeah.
Are y'all still using those gating criteria from the White House when it comes to looking at these orders?
We are, and so the question is about the gating criteria put out by the White House with respect to moving between the phases of reopening. And they have to do with COVID-like illness and people presenting to emergency room across the state with symptoms consistent with COVID. They have to do with cases, both the raw number of cases, is that increasing or decreasing, and our cases as a percentage of tests increasing or decreasing. and they also have to do with hospitalizations. I will tell you, in addition to that, the White House and Dr. Birx in particular focusing a lot more recently on positivity. And that even a small change upward in in positivity, meaning the percentage of tests that yields a positive result or confirms a COVID case, if that increases even by a small amount, then they're saying that means that in all likelihood you're going to see real growth in cases and more community spread. And so they're asking all the states to start looking really closely at positivity and get it below 10%, but also work to make sure that it's declining and not growing. And the only way to do this, and which is why Dr. Birx and others have called it a best practice, are doing those mitigation measures that we've already put in place here in Louisiana, the ones that we've been talking about. Yes, sir.
So in the lawsuits that have been filed to try to turn over the bar closures, one of the things they're arguing is that you shouldn't close down a whole class of businesses. You should focus on the bad actors. And you said yourself that a lot of businesses are cooperating because the bad actors will threaten to make it worse for everyone else. So is there any consideration of focusing on the bad actors and maybe lifting some restrictions that apply to the class?
So David, it's a good question, and it has to do with some lawsuits that have been filed to try to overturn the proclamations I've issued as they relate to bar closures. We have also had some filed related to the mask mandate as well. But David, you need to remember that I've also said that it's been determined by healthcare professionals that there are some environments, some venues that are so conducive to the spread of the coronavirus that they really cannot be done safely. And bar rooms are one of those, unfortunately. And we've seen this from data from all over the world, all over the country. And that is why Dr. Birx, and this is an official position of the White House Coronavirus Task Force, that bars need to be closed. And that's unfortunate. I know that negatively impacts the livelihood of a number of people. It's not something we want to do. We don't take any delight in it. But at the end of the day, we have a public health emergency. And in states like Louisiana, where you have this high incidence of cases, as defined by the CDC of 100 or more cases out of 100,000 population over the preceding 14 days, and you have increasing positivity, which exceeds 10%, then by definition, you've got to move to these mitigation measures, and the sooner the better. And by the way, the only way that we believe that we can get back to a rate of transmission of less than 1 and get the curve flattened again without having to go back to either phase 1 or to the shelter at home is to do those mitigation measures. And that is the mask mandate, that's closing the bars, that is reducing the social gathering crowd size, and making sure that we're doing those things, and those things have been termed best practices. So I'm aware of the litigation. Certainly, they have a right to go to court. I believe at the end of the day, the court will fully understand that not only do I have the authority under the constitutional laws of the United States to do what I've done, but what I've done is absolutely essential. And to the extent that there's a partisan element to much of what's going on, it's always interesting to me that people complain about my orders, but they never complain about the fact that they are 100% consistent with what the White House is telling states like Louisiana, and particularly Louisiana, this is what you need to do. And you know, and none of these decisions are easy. I've mentioned that before, but it's obviously the right thing to do. It's the best balance we can strike between public health on the one hand and opening our economy and our schools and so forth on the other. Yes, sir.
I asked about the letter you wrote to Congress on Tuesday about the unemployment insurance problem. Could you suspend the provision of law that kicks in the tax increase once it hits that $100 million threshold? Is that something you consider?
Well, you got to understand that the reason that the questions about the unemployment insurance trust fund and the declining balance in that trust fund We had about $1.1 billion in it back in March when this started. Today we've got a little more than $300 million in the fund because we've been paying out benefits to tens of thousands of employees who are out of work, and they qualify for benefits. And once that trust fund drains to a certain level, in order to ensure its solvency and the ability to continue to pay benefits as required by law, then a assessment is made, a tax is made, so the employers pay a larger pay tax on a larger portion of their payroll. I don't have the authority to suspend that, but if I did, we're not going to have any money to pay benefits either. The option that you have is to borrow money from the federal government, which you can do, and it's a decent deal in the sense that it's a interest-free loan. But when you borrow money from the federal government to shore up the solvency of the UI trust fund, you then have to have a surcharge on your employers as a means to pay the federal government back. And this is exactly the wrong time to be talking about a tax increase or a surcharge on our employers when we're trying to make sure that we have an economic recovery and that more businesses are open and more employees are able to go back to work. And so the letter that I sent to the congressional delegation, and by the way, we're working this hard through the National Governors Association, working with the National Chamber of Commerce and many other stakeholders, is to try to influence Congress so that in the Phase 4 legislation that they are negotiating now between the Senate and the House, that there's funding there for these unemployment insurance trust funds, because the situation in Louisiana is not unlike those of other states. This is a national problem, and I think everybody recognizes now is the worst possible time to do anything inadvertently or that would cause this tax increase. And taking no action is going to inevitably lead to a tax increase or a surcharge on our employers, and we really want to avoid that at all costs. Yes, sir.
Governor, this may be for you and Dr. Guidry. We have a copy of an agreement between LDH sent out to various offices of emergency preparedness on the parish level, telling them they cannot disclose COVID data, and when they get a new report, they have to erase the old ones, destroy it. Can you kind of talk about what's behind that, and if all parishes are getting it? We're hearing some parishes have started receiving.
Yeah, I'm going to ask Dr. Guidry to come up because he may know more about that than I do. I can tell you that one of the reasons you don't release information is because I believe we're identifying individuals who have this disease, and they have a right under HIPAA not to have that information out in public. And so that's why we're precluding, we want the offices of emergency preparedness to have it so they know what's going on within their parish, and particularly if they have to come into contact with those individuals, they know how to protect themselves or their first responders and so forth. So that's the purpose for sharing the information, and the reason why it can't be shared more broadly beyond that is a function of HIPAA. Is that correct? You want to add to that, or is that do it?
You covered it well, but I can add.
Well, come on up here and do that.
Personal health information, when you're sharing it, you have to strike a balance, but who needs to know? Who are you protecting? You need to protect the individual's personal health information. That's what HIPAA does. It tells you you have to protect their identification. So early on in this, we did something very different than we normally do. Normally, we don't share any information with local government when it comes to health care information. We shared some so that they knew in their community there were people with COVID, and if their first responders responded, they knew they might be exposed. Now, with as much COVID as we have, it'd make way more sense that rather than trying to find out who has it, when they had it, are they still infectious? You can't answer all these questions. So if you have a list of names, you don't know if they're over it. You don't know when they started with it. And so you're making decisions about treating them differently because they've had COVID. And that's not appropriate if they no longer have it. And it's not appropriate to share that with everyone because people will treat you differently. So we have tried to share to protect others without giving information that those folks would be treated differently, or you know, their health information wouldn't be protected. The problem that we've had is when we did share and we tell people this is HIPAA information, you're not to share with everyone, they have not always followed our guidance. They have shared, and they've put names out, and they've put information out, and that changes the way people react to you at your home, in your community. That's not what is intended. It was intended so that the first responders would know how to take protection. From the very beginning, we've always said, and we'll continue to say, if you don't know if someone has COVID, wear your mask, keep your distance, treat everyone like they have COVID. Don't start picking on those that make a list. That list changes every day. And that list isn't current always because it might have been they tested 2 weeks ago and they just made the list because the test results just came back and they're no longer infectious. So it's misinterpreted, it's shared inappropriately, and so it's dangerous when you start sharing information and it's not used for the purpose intended. But we have to protect individual health information.
To be clear, Dr. Guidry, these are the lists that like Red River Parish held up as evidence that the Department of Health is inflating its numbers, right? Is that part of the issue? Can you speak to that?
Well, you have where folks say we have information that doesn't match up with yours. And so when you think about this past month, there's over 500,000 test results. And you have folks at the local level, they're getting results from people reporting. They're getting results from different resources. We're getting all our results from lab reports. They're getting results from their local hospital or their local medical provider, and they're saying it's not matching up. Well, if it's not matching up, it's because there's different data sets and coming from different resources. When you look at over 500,000 tests, sometimes on those tests, people have taken multiple tests, and their name is spelled differently on the test. They went to different labs. They went to different places. And so we do a lot of work in deduplicating, trying to make sure that you don't have someone who took 5 tests and positive 5 times, that adds to the number. At the local level, at the government level, they think the numbers don't match up. But I'll stand by our numbers, and their numbers are as best as they can get. But at some point, it doesn't help you to know the numbers from the standpoint of knowing who they are because of the fact that it changes every day, it changes every couple of weeks, and it's hard to stay ahead of it. So the best thing to do with this disease, instead of trying to see, does your number match my number, is deal with the disease. Wear the mask, wash your hands, keep your distance. So it has been around the not matching of information. But I'll tell you, our information comes from laboratory tests and reporting from medical providers, and it's a lot of work to figure out that deduplication and that it's accurate. It may not match up with what local people have, and they don't feel comfortable, but they need to act like this disease is in the community, and the numbers are not going to change the way you behave. What should change is this thing spreads when you don't take it seriously.
One more thing. Earlier this month, the Department of Health asked hospitals if they have the space and the capabilities to create sort of mini medical monitoring station in their unused wings or whatever. Did you guys move forward with that? Are you still planning on moving forward with that? Is that going to make any dent in sort of this hospitalizations or anything like that right now?
When we started looking at that, and the question is, did we look at having a medical monitoring station at some hospitals around the state to address the overflow? When we started looking at that, there was interest, and several of the interested parties came back and said they're having staffing issues and might not be able to fulfill those. So we have 2 or 3 that are still expressing an interest, and we're keeping that as something we might use the need arises. But at this point in time, we're still looking at let's get this disease under control. But we do have it as a contingency if need be that we could find some extra beds. But staffing those beds is a real issue around the state. Thanks.
Thank you. And I will tell you the questions about the data and the test results. I have instructed from the very beginning, and LDH really didn't need to be instructed in this way, to make sure that we're doing everything that we can to have the most up-to-date, reliable data, and then to be as transparent as we can be with how we share that. And they go through great lengths with an automated system and a manual system to go into those test results and make sure that we are not counting more than one test for the same individual as being more than one case. And while I will never say that we're perfect. I will tell you that our data is very reliable. And I think you heard Dr. Ghali say today that what he's seeing on the ground in his hospitals matches up with the data that we're sharing for the regions that he operates in. And with respect to the medical monitoring station, Sam, I would remind everybody the principal medical monitoring station we have is at the Memorial Convention Center in New Orleans. It remains operational. It is set up for 250 beds currently. There is staffing for 60. We have 26 of those beds filled at this time. We do have very high degree of confidence that we can staff that for an additional 60 beds to get to 120 overall. And before we would have to look beyond that particular contract for more staffing. And even though that facility is in New Orleans, it has rendered service to individuals who are not just in Region 1, where New Orleans is, but Region 3, Region 2, Region 9. In fact, most of the regions of the state have had individuals in that medical monitoring station, so it remains very important, and it is the primary means by which we believe going forward we're going to have the capacity, this medical monitoring station capacity, to allow our hospitals to decompress so that the less acute patients can rotate out quicker and they can have that bed to turn over again inside their existing footprint. And so that decision to stand up, I think, the medical monitoring station at the Memorial Convention Center is one that continues to pay dividends. Yes, sir.
Ross Dellinger is reporting that the SEC has just agreed to move to the 10-game conference-only schedule about an hour ago. How do you anticipate that will affect the economy, given LSU was supposed to play a game against UT, an interstate game with Nicholls State, and another game in Houston? And then as a follow-up, do you see any scenario where tailgating can continue as normal in the fall?
Yeah, well, first of all, if they're not going to play the full schedule and we have fewer home games, then it will adversely impact the economy. I think we can all agree on that. And then we have to see what the circumstances are when those games commence as to what restrictions are going to be in place. And I try not to get out over my skis on this, and so this is going to play out over time. It's not as if I'm trying to hide the ball from anybody, but if I said something right now, it would be complete speculation, and I'm just not going to engage on that. I will tell everybody that we're in a new normal for the foreseeable future, and things aren't going to be the same as what we've experienced in the past, but exactly what that experience is going to be, I just don't know yet. And I'm guessing that happened since I've been at this podium, so I haven't had any chance to speak to anyone at LSU or elsewhere in order to figure any of that out. Yes, sir, this will be the last question.
Going off, saying on the topic of football, obviously as these conferences make these decisions, they're related to schedules. Obviously not touching, since schools are in different states, crowd sizes or anything. Not asking, obviously, we still have a bunch or plus until football, but is it eventually going to come down to you as governor of the state, for LSU's case, Mayor Broom and EBR, to discuss crowd size and how many people are going to be allowed at a gathering at an event?
Yeah, and that's certainly possible. I don't know the degree to which the NCAA, or in the case of LSU, the SEC, would impose uniform rules, and if so, what those rules would be. And then what additional flexibility the university may have based on whatever's happening here in East Baton Rouge Parish or in the state of Louisiana. But obviously this is something that could fall to Mayor Sharon Weston Broom and myself, at least to some degree, and we'll have to take a look at that. I'm just thankful that on January the 13th of this year, LSU did win that national championship, because that gives us a very pleasant and vivid memory that we have about that university and that football team. Anyway, it's one of the few things this year that really, for us here in Louisiana especially, a real bright spot, because it's been a very, very difficult year for our people, for our hospitals and our healthcare workers, for all those who've been suffering from COVID-19 and those who perished and all of their families. In addition, all of the business owners and employees and so forth. This has been a tough, tough year. And so to be able to continue to celebrate that national championship is important. And I suspect Coach Orgeron and the team had no idea back in January just how much that would mean to our state, because every passing day it means more. And so, as y'all know, I'm a tremendous LSU fan and football fan. So look, thank y'all for continuing to cover this. We will see you Tuesday at 2:30 in the afternoon back here in the press room. If that changes, we're certainly going to let you know. I'm going to again ask the people of Louisiana to understand that we all have a role to play, and I'm going to ask you to do that. Wear your mask. Stay home when you're sick. Socially distance from people when they're not from your immediate household, and wash your hands frequently. Reduce your activity. Go out of the home less often. And then when you go to the store, you don't need to take the whole family, and do all of these things, and we're gonna get back on top of these numbers again. I'm convinced that we can do it. The modeling shows that it will work. Early results in Arizona show that they have actually been able to flatten the curve again, and the situation is no different here in Louisiana. But this remains a very serious situation. There is more COVID-19 in Louisiana and in every community of our state today than at any point up to now. And so everyone needs to understand that. And then by working together, by supporting one another, by being good neighbors to one another, we'll get back on top of this. I'm absolutely convinced of it. But I want to thank you for everything that you have done, by the way, all the people of Louisiana. And for those people who haven't been doing their part and they know who they are, I'm sincerely asking you to do that. It's just incredibly important for all of us. So thank you, and we'll see you next Tuesday. Thank you again.